out.
You feel much better, like,
Yes.
oh.
Well, welcome everybody to our Sunday webinar series. Laura Carfin here with Abigail Johnston, and we are going to be talking about hospice. This is part of our every other Sunday MBC series where we talk about all things pertinent to the metastatic breast cancer community. And I am thrilled to be partnering with Abigail on these presentations because you're going out and helping to kind of shed light on things that we think about in our minds, but we don't actually know how to take action with or necessarily what the next steps are. And there are also some scary, challenging conversations that maybe within the MBC community, we know we have to talk about, but do our spouses want to talk about it with us, our family members, children, colleagues, etc.? So I thought today that we would continue the conversation, kind of building upon the last couple of weeks and months where we have been talking about hospice care and the different resources available to us, how to navigate hospice, figuring out kind of like even the interview process around hospice care, where we don't need just the status quo because there's one in our area. There's a lot of choices that we can figure out based on the characteristics and the culture of that center that could be a good fit for us. So I would like to welcome everyone today to this conversation. We are live streaming this on our Facebook channel as well as on our YouTube channel. So we will be monitoring the chats and conversations. And I will also say we were expecting Dr. Frankton, am I pronouncing that correct? To be here today and join us. But just like everything in life, I think we understand family emergencies come up, especially in our breast cancer world, where some days you're feeling great, some days you're not feeling so great, and things change. But nonetheless, I always say cancer doesn't take a vacation or sleep. So here we are live, and we are going to do a recap of what we know about hospice care based on the research that we've been doing the last couple of months and answer any of your questions. So thank you, Abigail, for joining us today and helping spearhead this webinar series.
Absolutely. And thank you, Laura, for providing the technical know-how to all of this. So just as a reminder, this webinar series came out of MBC Grieving Together, which is a Facebook group and an effort really to have these conversations in the MBC community that we started back last October. And I'm excited to say that we're scheduling in June because we have so many wonderful people that we want to talk to, who want to talk to all of you about the end of life conversations, about just what we go through in the MBC, or really terminal thinking about a truncated life expectancy and what comes next. And so one of the things we did end of 2020 was talk a lot about palliative care. And Dr. Medina from the Miami Cancer Institute gave us a lovely definition. So if anyone's interested, please look back at the podcast or the live stream, because I think that was one of the best kind of great panel discussions about palliative and what that looks like from a variety of perspectives. But one of the things that people do get confused about is the difference between palliative and hospice. So we would, of course, will welcome Dr. Fratkin back to talk about his particular focus on hospice, but we talked about how palliative care is available to anybody with a serious illness. It's a focus on quality of life. Hospice, in order to get into hospice, you have to have a doctor that certifies that you have 6 months to live. So that it's at the end. But it's also focused on palliative care, which is why I think a lot of people get confused about hospice versus palliative care. For palliative care, you just have to have a serious diagnosis. Hospice, you have to have a doctor that says you have 6 months to live. And I just looked up Merriam-Webster's definition of hospice, and it defines hospice. Interestingly enough, the first definition is a lodging for travelers, young persons, or the underprivileged, especially when maintained by a religious order, which I think is quite fascinating. Kind of that hostile type overlap there. It probably comes from the same root words. But the second definition is a program designed to provide palliative care and emotional support to the terminally ill in a home or home-like setting. so the quality of life is maintained and family members may be active participants in care. And so I love the focus on palliative, on home-like environments, on kind of the wraparound type idea that it's not just the person going through hospice, but it's the family going through hospice. So, you know,
Well, I
I
think
want to
it's
stop there if you want to jump in. Sorry.
kind of giving us this big picture, and I want to pause and linger on that conversation when your doctor tells you you have 6 months to live. I think a lot of times too, we are confronted with, well, no one can tell me this. Who are you to tell me how much time I have left? Or I'm in denial and I don't want to believe that, right? So, I
Yeah.
think there's kind of this dichotomy of, okay, here's some services. And we do talk about starting the hospice process early, right? If you find out that you're within that 6 month window, don't wait until 1 month where things are incredibly dire. But within that 6 month period, start thinking about what type of facility would be supportive, not just for you, but for your family and loved ones also going through every this transition with you. So,
Yes.
I think that's that tough reality of knowing that you're reaching the end and that we just want to make you feel as comfortable and supported as possible and honoring the choices that you have. So I wanted to just kind of acknowledge
Yeah.
how hard that conversation can be with your oncologist, and not wanting to give up, second, third, fourth opinions, clinical trials, hope. But I'm taken back to a conversation we also had with Jennifer O'Brien, who was on the call. She said so many great words of wisdom, and kind of lingering about, I'm not so worried about the patient. I'm worried about the family afterwards. I think that was something that really resonated with me. And um, that going back to your point, Abigail, of like this holistic, well-rounded approach of caring for the family during end of life, especially when it's truncated, as you mentioned.
Yeah, and there was a great checklist in Jennifer's book, The Hospice Doctor's Widow, that was her husband, who was the hospice doctor, his evaluation of whether or not to take the next chemo. And I think that that's always a thought process that those of us in the MBC community have, which is that weighing of, quality of life. Do I go from maybe a targeted pill therapy to an IV chemotherapy that is going to affect my quality of life in a bigger way? Or when you get to the point where you've gone through, 10, 12, whatever lines of treatment, and you're evaluating the ones that you could either repeat or the ones that are left, and do you want to have all of the side effects for perhaps a low percentage of efficacy? Meaning, you know, one of the things I think patients get very frustrated about, even with clinical trials, is there's, the oncology community gets so excited about this new med and it's going to add 2 months to your life expectancy. And so, when you get to those medications that may not extend, or they don't think will extend your quantity of life, coming back to the discussion about quality of life, I think is something only an individual can really can make. Your doctor can't make that decision. Your family can't make that decision. Only you can decide when you are not ready for that. And several of the people we've had on these webinars, the death doulas, the social workers, have talked about, a lot of times it's the family that's not ready to let go, where the person who is actually going through the illness might be ready, might say, I don't want to jump into this medication that's going to make me feel like crap. And so I think from a patient perspective, it's so important to think about that, and to think about, what do you want?
Mhm.
I think it's important to think about, in your visualizing your ideal death. We've talked about this a lot, that we plan weddings, we plan baby showers, we plan births, we plan so many of these transitions. It makes perfect sense to plan your transition into death.
Mhm.
And do you want that to be at home? Do you want that to be in a hospice facility? And that makes a big difference on which hospice agency you look at or you engage. But it has to begin with what do you want, or it should begin with what do you want, because then those decisions will be made for you.
Exactly. And I think when we talk about what is it that we want, that's also where some of this education from the series is coming from, because I would be clueless. I don't know what I want. I never actually had to think about planning for my own passing and the information that I will be leaving. And we hear time and time again, the best gift that I can give to my loved ones is kind of having that booklet of, okay, I'm dead. Now what? Right? Where are all the passwords saved? What do I want? What type of resuscitation do I want, if I even want to choose that, etc. So there's a whole list of questions I think that come up that are enlightening that we don't necessarily openly talk about. And I'm excited because I know coming up to, we'll put a little tickler out there for everyone listening. I think we're going to have kind of a game night on one of these upcoming webinar series that Abigail and I are inviting some friends who are the founders of what's called the Death Deck. And it's a card game that we are going to be sharing with everybody and kind of opening up that way of making light of something that's so heavy through putting the cards on the table, talking about our choices, and really opening up a space for dialogue. So stay tuned for that to come too, because I love this idea of a game night, despite the circumstances in which we might be coming together to play. Um, when we talk about, I think we're dancing around some of these questions, and I know I'm not talking concretely necessarily about what we should be asking, but I recall some of the conversations we've had with Mike. Is it Mike Whitaker from the
Matt
Choices?
from Compassion and Choices, yeah.
He gave some great examples also about when you're looking for a hospice facility. You mentioned even in that definition that there could be some religious affiliations with the venue that you choose. And so whether or not, if that's something that's important to you, to keep that in the back of your mind, because it might not be suitable for everybody. Other people were looking for more of the complementary type care, if there's going to be music or aromatherapies or massage therapies, et cetera, to make the stay a little bit more comfortable. And so I think these are some of the things that we can consider when we are talking to different facilitators about what their amenities offer.
Absolutely. I think one of the worst statistics I ever saw was and I don't even remember the exact one, but the amount of days that people, overall, the average number of days that people spend in hospice. And I think it's less than a week. I'm sure somebody who's listening will know. You get that 6 months, that the idea of the whole hospice program, which is paid for by the government through Medicare, is that you get that last 6 months to just be, to just, get your affairs in order, to spend the time with your family that you can. And so I think that shows you that people are entering hospice very late, that aren't getting the full benefits of what the program is designed to do. But how I understand it is that a hospice agency is given an amount of money, and that hospice agency can then decide how to allocate it. And so some hospice agencies might have chaplains. Some hospice agencies might have, like you said, acupuncture or massage therapy. And so I believe that it's important for those of us who are in a situation where we've received a terminal diagnosis to look into the different agencies that might then be able to provide those services to us. And every area is going to be different in terms of how many hospice agencies there are. Various areas where, if they're low, say a rural population where there's not a whole lot of people, they may not have very many agencies to choose from. I'll give a personal example. My grandmother is on hospice up in Ohio, and there was one agency. So it wasn't like she really had very many options, and she's in a rural area. But she's in a nursing home, and that hospice agency has been providing all kinds of extra services. Pre-COVID, they would have services where they would have somebody that would just come sit with her, and kind of that companionship, because that was identified as a need. And so if you're listening and you've got a family member in a nursing home, looking at hospice offerings might be something that could be very helpful for your family member.
Yeah.
Um, but in a big city like Miami, where I live, pretty sure there are 8 or 9 options. And so in a big city, you have maybe more of an opportunity to compare apples to apples.
Right. Right. Yeah, that's a great story. My grandmother has a very similar, or I have a very similar story with my grandmother as well, as she has since passed. But she makes me laugh. I feel like you just get to a point where they're just happy in their choices and where they are. And I remember calling her center. I just wanted to talk to her. She was still coherent and could answer phones and chat with everybody. But she was like, "I can't talk to you right now because my companion's here." And was just like, "I will call you later." Like, this feels
Nice.
really important. I was like, "Wow, I just got, like, left because she's talking." But it was just so wonderful and joyous, and made me feel good that she was taking control of that situation. And, you know, she had a lot of moments like that where it's like, "No, this is important to me, and this is what I'm doing now. You'll have to call me later."
That's awesome. But mentioning the control piece, I think, is super important because for those of us will be patients for the rest of our lives, there's so much control that's taken away from us, and so much of the you enter into the medical system and you no longer have autonomy as a person any longer in many ways. And so I think hospice, choosing when, choosing what, choosing how, all of those things about hospice really does give the patient a lot more agency, gives the patient a lot more choice. And I think that that's hugely important. But I also think that, like we were just talking about, that last act of love to your family, when you're enrolled in hospice and you pass, you die while you're enrolled in hospice, there's a lot of services that then continue beyond your death. A lot of counseling services for the family. When my other grandmother died while in hospice, there were lots of follow-up calls from the chaplain, from the psychologist, just checking in to make sure that the family was dealing with everything okay. And I think that as hard as it is to get mental health services in this country, for a lot of people, that hospice does include that as well, which I think is huge, and super helpful. Even if you don't need it, it's just great to have somebody checking on you. I mean, I think that's great.
Yeah. Yeah, absolutely. I mean, I was even telling someone too, like, a lot of times, especially at the immediacy once someone passes, there will be an overflood of "How can I help?" phone
Yes,
calls, cards. I even remember in my own breast cancer diagnosis, I'd be flooded with, like, the edible arrangements and the flowers and the cards and the phone calls and the text messages, and then it definitely fizzled out as I, quote, unquote, "was no longer in active treatment," and
right.
no one is checking on me anymore. And so now it's like this funny dance of, do they want to ask? Do they really want to know? Do I want them to ask? Do I not want them to know? Right. And so I think another takeaway was, ask that person in that time of, everyone's reaching out, they want to bring over meals and they want to help and support while you're grieving. Say, like, can you email me or call me maybe in about 6 months? Like, put it in your calendar now
Yeah.
so that you can check on me later when I am going to need that touch point. And so I think that's a really important piece of that ongoing care and support that that
Yeah.
happens.
Yeah, compassion fatigue is definitely a thing. And I think, too, for those of us in the metastatic community, the longer we live, which is amazing, by the way, that we outlive those statistics or those medians or those averages, and we all want more time. But the amount of help or the amount of oversight sometimes, it does fall off or fall away. Um, and it's an issue for anybody with an ongoing, and I'm not saying that metastatic breast cancer is chronic, but for anybody who has any kind of chronic illness or chronic symptoms, um, there is that compassion fatigue. There is the, oh, well, why isn't that over with? Like, why are you still dealing with that?
Exactly.
Um, and I actually had a couple of conversations this week with people who were hearing from family members, well, why are you still dealing with this? Like, why are you still so sad? And it is hard for people who are outside the maybe the inner circle of the patient to really fully understand um, the ongoing issues. And again, I don't think that metastatic breast cancer is chronic, but so many symptoms become chronic. Pain becomes chronic. Different blood levels become chronic, anemia becomes chronic. And so I think it's important for everybody to remember, just like if somebody has passed or if somebody has a serious illness, all that help does fall off. And so it is nice to have somebody who stays the course or who kind of backs off for a little while and then re-engages.
Right, right. And I think that just ties in very nicely to everything we've been talking about these last couple of months about the levels and moments of grieving, right? So, like, you could grieve
Yeah.
initial diagnosis, you can grieve leading up to all of those scans and the next steps, and eventually, when you are being told there is a 6-month window and what you're supposed to do. One question that I had, and I could be conflating a couple different conversations, with hospice, is that always at a facility, or do I have stories where people have like hospice care at their home? And yeah, okay, so that's a
Yeah. So in some ways, at least here locally, most of the hospice organizations provide care at home. And they actually have very few with inpatient hospice facilities. There's also the opportunity for respite care. And so I do know some people who were going through hospice or being supported by hospice mainly at home, but because their needs were so great and their caregivers struggled at times, they could go into a facility for a week or even just a weekend so that their caregivers could get some respite, some space to recharge. The sad fact of the matter is, while there's money for the CNAs or kind of the nurse assistants to come into the home to help with things like bathing and just getting up and moving and that sort of thing. A lot of times the agencies aren't staffed very well, and so if somebody needs 24-hour care, some agencies are going to struggle with whether they can actually provide 24-hour care. And so a lot of times that inpatient facility is the only thing that is appropriate. And sometimes that's in a nursing home type facility. Sometimes it's in an actual just hospice home where it's only people who are transitioning. But there's a lot of options. And that really comes back to the patient hopefully thinking through what they want, but then also having that conversation with the caregiver or caregivers, whoever those people are. What can they do? What can they actually maintain? If you are working a full-time job and you have children, are you then going to be able to care round the clock for an aging parent? That's probably pretty hard, and then probably a big ask if you can't take time off or something like that. And so again, it's just about having the conversation and talking about what's really possible. I think in my own life, I have seen that a lot of people um, will want to do things that are maybe beyond what they really can do.
yeah,
And as a patient, just giving permission to people to say, okay, if that's what you can or can't do, then there's no judgment. Like, everybody has a different capacity, everybody has different strengths, weaknesses, and abilities.
exactly. Exactly. I think you bring up a good piece too about the financial side, and the more information you can be researching in advance and planning for in advance, then you will know what options are available to you when that time comes, and it'll be a little bit less stressful. It's
Yeah.
stressful regardless. We talk about the financial toxicity as well of a diagnosis and passing, but it's
Yeah,
recovery.
I think it's come up in almost every context in the webinars that we've had. Making a decision while you're feeling well before there's a crisis is always better than trying to make decisions in the moment. Certainly, your decision in the moment might be slightly different from what you thought you might want. I think there's no way to anticipate the level of incapacitation when you get to that 6-month period. It may be that you're not walking anymore. It may be that you legitimately cannot care for yourself in any way at all. And so I think that it's always good to work through as many scenarios as possible beforehand so that you have those paths laid out so you can select the best one in the moment.
Yes.
But having that thought process and laying out those paths when things are not in a crisis point, I, you know, it's appropriate for almost everything that we've talked about in this webinar series.
Yes, absolutely. Well, I think it's what a gift to be able to plan for this. I think, sometimes talking about death and these conversations, it's funny that we've been having these conversations every other Sunday, and I literally go to sleep with William and I'm like lying in bed talking about death and planning for death, and my Sundays, have this emotional roller coaster as we prepare for our week. But I'm grateful for them, and I'm not sure if anyone else who's listening resonates with that, right? Where we've been having these tough conversations on a Sunday. But compared to, and I'm super scared also because, our parents are getting older. We're in this situation of COVID where we're not seeing a lot of relatives the way we used to. And there's
Yeah.
legit fear of what happens when the time comes for passing. Are we ready for it? Am I ready for it? Part of me still feels like a kid, like I'm definitely not ready for death. And I've been very fortunate that I haven't had to deal with a lot of um death in my life. People have lived very long, healthy lives, and knock on wood, there hasn't been a lot of traumatic trauma. Whereas I know I'm learning so much from others in our community that have lost parents at young ages, have been diagnosed, have lost their spouses, etc. And until you really go through it personally, it's very hard to relate to and know what you're prepared for or not prepared for. And so I'm just kind of sharing all of this because it's important, having not experienced that firsthand, to take this information and figure out, okay, I have an opportunity here, versus those stories we hear where someone gets into a car accident and their life is just completely upside down. And that,
Yes.
we don't have that opportunity to plan for those moments. But in these
Right.
things where we go back to that control piece of, okay, well, no one gets out of here alive regardless. So let's plan for the best of it and what actions we can take, um, for ourselves and for our loved ones as well. So,
Yes. Well, and before NBC, I was exactly where you were. Certainly, I had lost a few people in my family, elderly grandparents, but had not really experienced the death of somebody who was closer to my age or who that I was significantly close to. And, it is a completely different experience going through the deaths of people who you know well, who are young, who are you in another body, right? So the same circumstances, little kids for me, ages, that sort of thing. And it is a very, very different experience. Just a small shout out, April Stearns over at Wildfire is going to be publishing the next issue is on grief and dealing with grief in this context of metastatic breast cancer, because we're losing people at a rate of 116, or maybe it's now 119. The numbers have gone up here for 2021, but we're losing at least 116 men and women every day in the United States. And inevitably, those of us in the community, we know those people. They might be advocates who have really put their life out there in public. It might just be somebody local. And knowing how to navigate that loss, that grief, that then triggers almost a PTSD for those of us in the community, it's a very different thing. Speaking of hospice, there is a long-term unicorn who has entered hospice recently, Sandra Spivey, out in California. Is it 22, maybe 23 years living with MBC? When she puts together her trajectory of treatment, it's a paper taped together that go across an entire room. I saw her unfold her chart, and it took like 6 people to hold it up.
wow.
She's been through so much, but now she's transitioning, or has transitioned, into hospice. And because she's lived so long with MBC, and because she's touched so many people's lives and influenced so many advocates, I've seen that really affect the MBC community in a very different way, um, because she's been a beacon. She's been a beacon of hope in a lot of ways. The podcast that Share Cancer Support does, our MBC Life, recently did a podcast on unicorns, and they had Janice Cowden, Terlisa Shepard, Julia Mawis, and Sheila. I'm going to forget Sheila's last name. Oh, sorry, Sheila. Anyway, unicorns, people who have lived beyond the statistical suggestions. I'm going to call them suggestions because we're not statistics, right? But they lived beyond even what their doctors thought that they would. Sheila specifically has been on a clinical trial, I think, for 4 or 5 years now. And it's good to hear about those people who have been living longer, who have beaten the odds, so to speak, who are living their best life. But every single one of them reminded everybody in that podcast that there's a portion of that that's just luck. There's a portion of that that science doesn't understand. And there is actually a study going on at the University of Wisconsin trying to figure out what it is that ties the unicorns together. What is it that helps them live longer with this awful disease, because the doctors want to be able to replicate that for all of us. But the sad fact of the matter is, the statistics that we have is that only 24% of us will live beyond 5 years with metastatic breast cancer. And so that means that we have to face this whole death and dying thing, because it's happening all around us.
Right. It's almost like, before you get to that 6-month conversation with your doctor, who's telling you the 5-year conversation and providing you with the statistics and the facts from the data at the time, right? And it doesn't say that this is you and this is your story and this will happen to you, but it's also the reality, I think, acknowledging that there is no cure once it has metastasized, and that there's constant maintenance and treatments to keep going, but there's options and there's hope. And I love hearing those unicorn stories too, because you want to know, like, why you and why not her? Why not all of us? Why? Like, there's so much why. And it definitely, I struggle with it. It keeps me up. Very, you want concrete answers. You want to understand. You want to do everything you can. You want to emulate. Okay, what is she doing that I'm not doing or could be doing? And it's very challenging. So
it is. And I think as human beings, we all want that answer. We all want the objective. If I just don't drink alcohol, or if I just, never eat sweets again, or if I just cut out carbs, or if I just fill in the blank, exercise twice a day or whatever it is. But the sad fact of the matter is, just like there's no way to prevent cancer, there's no way to cure cancer, and there's no way to know or anticipate why one person is going to respond differently than another, except for, some broad things like subtype or staging. There are some things that give us an idea. And there are, to be honest, some doctors who feel very comfortable saying, you now have 1 more year to live. And I've never really fully understood that. I'm sure they believe that they're giving their patients something valuable. But the fact of the matter is, nobody knows. And that, to me, gives me a different impetus to try to plan, to try to look at, okay, I have so many more lines of treatment left, planning for as much as we possibly can, even though we all live 3-month increments from scan to scan. Mine is this coming Friday, so I'm really thinking about that at the moment. But the opportunity to not, for me anyway, to not worry about what's next is planning, is putting a plan down in writing that may or may not happen. We have to deviate sometimes, but at least having that done and in the drawer for when we need that plan, that helps me then focus on now. And I think that anything that helps us be able to focus on the present, enjoy the present as much as we possibly can while living with something so serious, to me, that's a win. That's a huge win, which is why I think these conversations are so important.
Yeah, absolutely. One question I have for you, Abigail, if I can put you on the spot also, as you're talking about the 116 or 119 friends of ours and people in the community that are passing every single day. What are some of the strategies you take to be compassionate yet resilient? I know that you have your Grieving Together Facebook group, which is helping so many people, having a place to cry, to share sadness, to let it all out, so to speak, in this community. What do you say to the people listening, and even to myself? Like, I don't even know. Sometimes it's just so like knocking things down with a hammer again and again and again, yet we still have to keep showing up and trying our best, which is, I think, why we do the work that we do. Um, but we gotta
Yeah,
just putting it out there that it's hard. Like the people that are listening
it's
and
hard.
like, it's not.
It's not easy. Yeah, you're absolutely right. And it's interesting. We were just talking about this in a support group the other night, and I was talking about how one of the first people that I was super close with who died, it totally sent me into a tailspin. And there was a big part of not really wanting to engage as much, not really wanting to get close to people who were going to die. It's a weird relationship because you know that one of you is going to die first. And the best thing that I can say, maybe not the only thing, but the best thing, it is just really about how we're built for community. And as human beings, we're not meant to be alone. We're not meant to do hard things by ourselves. I see over and over in the support groups, whether it's online or verbal, that people come in carrying the weight of their day, of their experiences, of their treatment, of their scans, and they leave lighter. They leave with a smile on their face. And it's not that that there's been a comedy show or something. It's not like there's been something entertaining, but it's being around people who get it. The whole concept of a burden shared is a burden lightened. That when you talk about the things that are weighing you down, that it becomes easier to handle. And so I have found a whole different set of ways of being resilient that really are all subsumed in the idea of community, and the ability to talk to people who you say one thing, you can say chemo and people get it. You can say, I have a scan coming up and people know exactly how you're feeling. And so that's why I think community is just so, so, so vital. I can say that there are times though that I will pull back, especially when somebody that I'm close with has died. Um, but then I'm reminded that we carry on their legacy as much as their family does, right? Those of us in the community who know these people. Um, the whole reason that I'm involved in Compassion and Choices as the team leader for Miami is because one of the women who I was in a Hear My Voice class through Living Beyond Breast Cancer with, she never got to do her project. And so I picked that up for her. And it's those times of being able to carry on each other's legacy, each other's voice, to keep the people who are so important to us alive. I think that also really plays into the we all have a hope that someone is going to do that for us. And so by doing it, by showing that example to the people who come after us, means that um, we we won't ever completely disappear. Um,
Yeah.
I was in Orlando last weekend reading some poems that were uh, by the poet Anya Silver. And she has a great poem called Deathless that she talks about being on the beach, that, the ocean is deathless. It comes, it recedes, it comes, it recedes. And that there are these things, whether it's the circle of life or however you want to describe it, but who we are lives on, our spirit, our energy, however you want to describe it, from whatever belief system you are, that our legacy really does live on. So I guess that's a really long answer to the question you asked.
Answer, honestly. And I think it's that altruistic idea that life is bigger than us. It's that community
Mhm.
that is so true. I see that in over the last 4 years, how my life has completely changed since this diagnosis and how I thrive when I meet other survivors and thrivers and people diagnosed. It's immediately like, "Oh god, I'm so sorry." Like, I even found myself saying like, "Oh, I have breast cancer." I'm like, "Oh, great, okay." I'm like, "No, not great. I'm sorry." But, like, we're so happy to meet you, right? Like, we say the funniest things because we're like, we get it immediately, and we
Yeah.
don't go and, define all the chemo treatments and terminology and vocabulary, but it's this instant bond and
Yes.
being able to carry that on. I think I'm excited for this webinar. I'll definitely be it's obviously recorded. We'll repurpose it and share it out with all of the resources that we were mentioning in today's conversation as well. I love what you're doing with compassionate choices. And I'll share, you may or may not remember this, but in 2019, Abigail, you were introducing me to ABCD, the After a Breast Cancer Diagnosis group that's based out of Wisconsin. And I recently got in touch with them and I'm going to become a volunteer for them as well as one of their peer mentors. So I'm just super
Wonderful.
it's just one of those things where you can't I'll speak for myself, like I can't give enough to to help and share and support, and I know we don't always have the same answers, but having the conversations is the step in the right direction.
Yeah, there's that, what is it? The metaphor of the starfish, where somebody is walking along the beach and throwing the starfish into the ocean, and another person says, you can't possibly save all the starfish. And the response is, but to this one, I can save this one. And so I think that that concept applied to other people, that we cannot help everybody. My husband keeps reminding me of that as I want to, donate to all of the fundraisers and help all the people. But we can do something amazing for the people in our circle, for the people around us. And, doing that means that then that person is going to be able to pay it forward beyond that. And that is how we change things, is just one person at a time.
Exactly. I love that. Well, on that note, thank you everyone for listening and watching, and we will continue this in 2 weeks. What is I forget, is our topic in 2 weeks? Is it the grieving circle, I believe?
I should know the answer to this.
Well, stay tuned. We have to line up every 2 weeks. We got some card games coming up. We have some more
Yep.
conversations. We're speaking with some family members who have lost their moms to NPC. And if there's ever topics you guys are looking for or interested in, you can always reach out to Abigail or myself, and we'll get working and add it to the calendar. So have a beautiful evening. Thank you for joining us, and we'll talk next time.